Hey, I'm Dr. Deuk, and it is March 4th today, I think, and this gentleman sitting next to me just had his Deuk laser disc repair surgery yesterday. So if you were watching, you saw me do 3 disc herniations. How did you injure your back?
At work is where I injured my back, and it was painful. It did not feel good at all, lifting cases all day. Yep.
And did you try some other stuff first to see if it would take the pain away?
Yeah, I tried a couple things. Pills weren't working. You know, the injections, they just didn't last long enough, and now I got that laser done. It feels totally different. Relief.
Good.
A big sign of relief.
So, I guess you should thank your work comp carrier, right?
Yep. Thank you.
And your adjuster and all the people, the nurse case manager that got you here to Deuk Spine Institute to get your Deuk laser disc repair.
Yep.
So, what are you going to do now that you're feeling better?
I'm going to take it easy.
All right, good. Take it easy for a little while until it heals up.
Yep.
So, how bad was the pain before the surgery in your lower back from this herniated disc?
If you had to do a scale from 1 to 10, I say it was about an 8 to 10 off and on each day, just the spasms and all that. But now, you know, I'm back down to maybe just like a 3, 2, and that's only because of the soreness.
The soreness from the surgery.
From the surgery.
So the pain you had in your back, in the spine before surgery, is it still there, or?
No, I don't feel that.
So it's gone.
Yeah,
good
it's
for you.
Gone.
All right, so I'm kind of curious. You know, you're a work comp injured patient, right? And you talk to doctors, a lot of them say, oh, you guys are all faking it, there's nothing wrong with you. I don't believe that. I know you had pain.
Oh, yeah.
What do you have to say to people that think people with work comp injuries aren't telling the truth, they just want to get out of work?
Oh man, that's a bluff. Because they're definitely telling the truth about some pain.
I agree.
Yeah, it's definitely there, and don't ignore it. I think that's the worst thing you can do about it. If you're waking up every single day and you're going to work and you feel that stress in your back, if you feel that, then you need to do something to get it looked at. I mean, come here and at least get a test or something.
Do you remember what you asked me in pre-op before surgery? You said when, I think it was before surgery, you said, when can I go back to doing my job?
Yeah.
Right?
Yeah.
Now, what do you do?
I lift cases all day, technically.
You truck driver?
Yeah, I'm a truck driver.
Unload and load?
Yep, unload and load every single day. 16,000 pounds.
Yeah, and so with somebody who wants to get out of work, ask their surgeon, like before surgery, when can I go back to my job? I want to go back as soon as possible. That's really impressive. Well, good luck to you.
Thank you, sir.
Yeah, anything else you want to say to the rest of the world before we sign off?
Come here and get looked at. Don't waste time.
Thank you very much. Thank you.